Hello, my name is Analysa, and this is our final assignment for Social Work 621, where we will be demonstrating a technique or an assessment that we would use with the client during a one-on-one therapy session. Like I said, this is just a school project. It's purely for educational purposes, so only my professor will see it. She's not going to share it with anybody. Your information's not going to be shared or given. Do you consent to participate?
Yes.
Fantastic. This is Aaron. He is 17, male. His pronouns are he, him, his. His parent has brought him to me for some substance use and abuse, and we will be assessing him. This is his first session using the craft assessment. So the questionnaire that you did with your parent before you got in, you answered yes to a lot of those questions. So what I'd like to do is just go over it one more time, and I'm going to ask you the questions this time, and we can sort of have a chat from there, okay?
Okay.
Okay. So the purpose of the questionnaire that I gave you and the assessment that we'll be doing today is just for me to gauge where your levels are with your substance use and assess how much intervention we need to do for you.
Okay.
Just as an example, the questions are going to be really similar to what you answered previously with mom. And my questions will be the same today. They'll be about how often you use, when was the last time you used, and how you use. Okay? Okay, let's get started. I'm going to ask you a few questions that I ask all my patients. Please be as honest as possible, and of course, these are kept confidential. So, during the past few months, you're going to think about how many days you did the following questions, okay? So, how many days out of the past 12 months, you just give me a rough number, did you drink more than a few sips of beer, wine, or any drink containing alcohol?
Definitely a majority of them. I don't know exactly, but at least 200.
Okay. 200 days of the last 12 months.
Mm-hmm.
Okay. And again, the last 12 months, we're just thinking about just a rough estimate of days. Did you use any marijuana, weed, oil, hash, smoking, or have you vaped, used any THC?
Yes, I have, yeah.
Okay. And again, how many days do you think?
Oh, out of the year?
Mm-hmm.
Yeah, probably like 200.
Okay.
Maybe a little more.
And then lastly, again, thinking about the number of days, how did you use anything else to get high, such as other illicit drugs, over-the-counter medications, prescription pills?
Yeah, sometimes, yeah.
Okay.
Sometimes whatever was around.
And thinking of it in terms of days, how many days would you say?
On those other substances,
Mm-hmm.
maybe like a third of that's like, I don't know, 50, 75.
Okay. 75 days. Okay, thank you. Have you ever ridden in a car with somebody or driven a car being under the influence?
Yeah, a few times. I know it's not safe, but yeah.
Okay. Do you ever use drugs or alcohol to relax?
All the time, yeah. That's probably the main reason I use it.
Okay. Do you ever use drugs or alcohol while you're by yourself?
Yes.
Do you ever forget things when you're using drugs and alcohol?
Oh yeah, it happens. Sometimes I forget the whole day.
Okay. Do you ever use drugs or alcohol with family? Do they tell you that you should stop?
Yeah, my mom doesn't like it very much. I don't
Okay.
think any of them really do. I don't do it with them though.
Just around them, or and they've told you that they'd like you to stop, or
Basically, yeah.
okay. And have you ever gotten into trouble while you were using drugs or alcohol?
Yeah, a few times. A few times we've been on the wrong side of the law.
Okay. Let me see your score here. So you can see your score here is pretty significant. You have higher than a 6, which would indicate a substance use issue, which is why you are here, and that's okay. We're going to work on it. So, can you tell me a little bit about why you're using drugs and alcohol?
Just as like an escape, mostly. It's a
Okay.
good way to relax during stressful situations.
And stressful situations for you right now are what?
Like almost anything. Coming home, my mom's yelling, trying to think about school, and just wanting to hang out with my friends. Everything's pretty stressful.
Okay, so I'm hearing it's important for you that you hang out with your friends. Do your friends do drugs and alcohol as well?
Yeah, mostly, some of them.
Okay. Well, as you know, a mental health clinician and somebody working with your mom towards your well-being, of course, I do recommend that you attempt to stop. But we are here to work on that and how we can help you to stop the use, lessen, and then stop hopefully the use. So it doesn't go as far as to get you in some serious legal trouble or even some medical trouble.
Right.
Okay. Also, I'd like to discuss one of the questions. I mentioned, being in a car, or being the one driving a car while you were under the influence. So, what do you think about that? You mentioned, it's not safe, but you did it anyways.
Well, it's kind of like the soberest one in the situation. I felt like my friends who I was with were not more suited to drive than myself.
Okay. And so you felt like you could be the safest driving home, even though you also were under the influence.
Yeah, I felt like I was the most in control.
Okay. And for future purposes, do you think that you would be liable to do that again?
Oh no, not if I couldn't help it.
Okay, so you've already given this some thought and you wouldn't drunk drive or drive under the influence.
I would try not to. It's hard.
Okay, so what's a good way that we could try not to in the future?
I guess maybe not drink so much or do so much and make sure I have a trip or a ride ready.
Right, yeah, an Uber, a Lyft, maybe a trusted friend or even a family member that might come grab you if you are in that situation.
Yeah, that's a good idea.
Okay, good. And do you feel comfortable calling a parent or a close family friend?
Yeah, I got a few people I can call, I think.
Great, okay. Oh, fantastic. And what is your motivation for coming here? Because I know Mom had talked to you about it, and you guys kind of both agreed to come here, so it wasn't so much, not your choice. You do want to get some help for this.
Yeah, it's mostly because there's some times where I just kind of spiral. It just gets really bad. I just keep using stuff and I just like lose huge chunks of time, like days. And I definitely want to stop that from happening and at least control what I'm doing more.
Okay. And what do you think your response could be to friends or family or people who sometimes you do use with, as to why you're trying to stop and quit?
Just, I don't know, be careful.
For
Try
them
not
to be careful?
Yeah,
Okay.
because it does more than just make you have a good time.
Okay. So how could you keep yourself motivated in order to not use anymore?
That's a hard one. I'm not too sure. Maybe just stay around people that don't use so much.
Good. Yeah, no, I think that's a really good question or a good answer. And just for your own purposes, what would be the benefits of not using anymore?
can definitely see myself achieving more, and not being in trouble all the time.
Right.
That's the main one, yeah.
Yeah, definitely. And keeping those goals at the forefront of your mind, you know,
Mm-hmm.
that you want to reach them. You want to graduate high school.
Mm-hmm.
You know, you don't want to get in any legal trouble or be very sick as an adult.
Yeah, definitely don't want to get held back.
Yeah, absolutely. And you're so close to graduation, right?
Mm-hmm.
Of course. Okay. I think that you have a really great footing on this. I think the first step was you coming here willingly, and I think this is going to go really well. You seem very open to some assistance in this area, and I promise I'm here for you, not judging you. And this assessment was just for me to get sort of a gauge at where you are with your substance use. Okay.
All right. Thank you.
Thank you. Okay, Erin, so what we're going to do next is have you sign the contract for life. I'll go over it with you, and then we can have Mom also come in and sign her portion, since she is being an advocate and has brought you here. And essentially what this contract is just to help keep you accountable for the choices that you're making, and also Mom to help you through this, and remember that she is a partner in this with you to help you lessen the substance use, okay? And again, the contract's just to facilitate some communication between the two of you, so you can continue to have this very open relationship, and receive the best help from each other that you can. Thank you.